Dear students, welcome back to my channel, Learn with Professor Janula. In this video, we'll discuss important clinical Viva questions on antenatal examination to help you prepare confidently for your exams. If you find this helpful, like, share with your friends, and subscribe for more exam-focused nursing videos. Let's get started. Antenatal assessment is the regular health checkup done for a pregnant woman during pregnancy. It helps to monitor the health of the mother and the baby. It also helps to identify any problems early and prevent complications. Overall, antenatal assessment ensures a safe pregnancy and a healthy baby. What are the objectives of antenatal assessment? Antenatal assessment is done to ensure the health of the mother. It helps to assess the growth and well-being of the fetus. It helps to identify high-risk pregnancies at an early stage. It also helps to prevent complications during pregnancy. What is the normal duration of pregnancy? The normal duration of pregnancy is 280 days or 40 weeks. It is calculated from the first day of the last menstrual period, also called LMP. What is Naegele's rule? Naegele's rule is a method used to calculate the expected date of delivery, also called EDD. It is calculated by adding 7 days to the first day of the last menstrual period, then subtracting 3 months, and adding 1 year. This rule helps to estimate the due date of pregnancy accurately. What is gravida and para? Gravida refers to the number of times a woman has been pregnant, including the present pregnancy. Para refers to the number of pregnancies that have reached the age of viability, whether the baby was born alive or stillborn. These terms are used to describe a woman's obstetric history clearly and accurately. Why is blood pressure checked during antenatal visit? Blood pressure is checked during antenatal visits to detect pregnancy-induced hypertension. It also helps to identify preeclampsia at an early stage. Early detection helps to prevent serious complications for both the mother and the baby. Why is weight monitored during pregnancy? Weight is monitored during pregnancy to assess the nutritional status of the mother. It helps to identify abnormal weight gain or weight loss. It also helps to detect complications such as pregnancy-induced hypertension and intrauterine growth restriction. Regular weight monitoring helps to ensure the healthy growth of the baby and the well-being of the mother. What is pallor an indicator of? Pallor is an indicator of anemia. It occurs due to a reduced level of hemoglobin in the blood. Pallor is commonly seen in conditions like iron deficiency anemia, especially during pregnancy. What causes pedal edema in pregnancy? Pedal edema in pregnancy can be caused by physiological fluid retention, which is common due to hormonal changes and pressure of the uterus. It can also be caused by pathological conditions such as pregnancy-induced hypertension. Therefore, pedal edema should always be assessed carefully during antenatal visits. Why should the bladder be emptied before abdominal examination? The bladder should be emptied before abdominal examination to provide comfort to the mother. An empty bladder allows proper palpation of the abdomen. It also helps to avoid inaccurate findings during examination. This ensures a more accurate and comfortable antenatal assessment. What are Leopold's maneuvers? Leopold's maneuvers are 4 systematic abdominal palpation techniques. They are used during pregnancy to assess the position of the fetus. They help to determine the fetal lie, presentation, position, and engagement. These maneuvers are an important part of antenatal abdominal examination. Name the 4 Leopold's maneuvers. The 4 Leopold's maneuvers are: first, fundal grip; second, lateral grip; third, pollex grip; fourth, pelvic grip. These maneuvers are used during abdominal examination to assess the fetus. What is assessed by fundal grip? The fundal grip is used to identify the fetal part present in the uterine fundus. It helps to determine whether the head or the breech is occupying the fundus. This assessment helps in identifying the fetal lie and presentation. What is assessed by lateral grip? The lateral grip is used to locate the fetal back. It helps to determine the position of the fetus inside the uterus. This grip also helps in deciding the best area to auscultate fetal heart sounds. What is assessed by Pollak's grip? Pollak's grip is used to identify the presenting part of the fetus. It helps to determine whether the head or the breech is presenting. This grip also helps to assess mobility of the presenting part. What is assessed by pelvic grip? The pelvic grip is used to assess the engagement of the presenting part. It helps to determine whether the presenting part has entered the pelvic inlet. This assessment is important to understand the progress of pregnancy and readiness for labor. What is symphysis fundal height? Symphysis fundal height is the distance between the upper border of the symphysis pubis and the fundus of the uterus. It is measured using a measuring tape during pregnancy. This measurement helps to assess fetal growth and gestational age. It is an important part of antenatal abdominal examination. Thank you for watching this video. I hope this session was helpful for your clinical Viva preparation. If you found it useful, please like, comment, and share this video with your friends. Don't forget to subscribe to Learn with Professor Janula and press the bell icon for more exam-oriented nursing videos. See you in the next video. All the best.